Doctors are often seen as the ultimate authorities in healthcare. They are expected to have immediate answers to and solutions for every medical problem. However, the reality of modern healthcare is more complicated. Physicians frequently encounter questions they can't answer. This is usually due to medical uncertainty, lack of sufficient research, or systemic barriers. The result is often cognitive dissonance. Cognitive dissonance is a psychological term that describes the discomfort or tension that arises when a person holds two or more conflicting beliefs, ideas, or values, or when their actions contradict their beliefs. This dissonance creates a mental state of unease that motivates people to resolve the inconsistency. Cognitive dissonance in doctors' offices. Doctors are expected to be experts, yet the complexity of medicine often means they face rare conditions, incomplete information, or questions about treatments that lack clear evidence. This can happen when faced with medical uncertainty or the limitations of the healthcare system. These situations can create an internal conflict. Our doctors are expected to know everything, yet sometimes they cannot provide a definitive answer. So in response to such dissonance, doctors may react defensively, avoiding discussions that reveal uncertainty or relying on standard responses to maintain the facade of certainty. Unfortunately, such behaviors can distance doctors from their patients and compromise the quality of care. The impact of cognitive dissonance on doctors also conditions them to avoid showing vulnerability. This reinforces a culture in which admitting "I don't know" is seen as a weakness. The need for transparency. Most patients value transparency even when it means hearing that the doctor doesn't have an immediate solution. One study from the year 2000, published in the Journal of General Internal Medicine, found that patients who received honest and open communication from their doctors were more likely to feel satisfied with their care. These patients also had a better understanding of their health conditions. Doctors should also feel comfortable admitting uncertainty. They should also openly discuss the constraints that affect their ability to deliver care. For example, if a patient asks about an alternative treatment that the doctor is unfamiliar with, the doctor can respond. They might say, "I'm not sure about that option. However, I can look into it or refer you to someone who specializes in it." This is one way to manage cognitive dissonance and strengthen doctor-patient relationships. Practical solutions for addressing cognitive dissonance in healthcare. Number 1, acknowledge uncertainty. Doctors should not avoid difficult questions. Instead, they should embrace the chance to discuss uncertainty. A simple way to do this is by admitting, "I don't have all the answers, but let's explore the options together." Number 2, educate patients. By improving patient health literacy, doctors can empower patients to understand the complexities of medical care. This understanding can help reduce the pressure doctors feel to have all the answers. Providing reliable resources and encouraging informed decision-making can further empower patients and lighten the load on doctors. Number 3, advocate for systemic change. Addressing systemic barriers is crucial for reducing external pressures that contribute to cognitive dissonance. These barriers include insurance limitations and administrative burdens. Doctors can play a role in advocating for healthcare reforms that prioritize patient-centered care. Number 4, normalize transparency in medical training. Teaching future doctors how to manage uncertainty is essential. Being transparent with patients is also essential. This creates a healthcare culture that values honesty and collaboration over perfectionism. In conclusion, cognitive dissonance is an unavoidable challenge in healthcare. However, it doesn't have to undermine the doctor-patient relationship. Doctors can reduce their internal conflict by acknowledging uncertainty, being transparent about systemic limitations, and embracing shared decision-making. Ultimately, fostering a culture of honesty and collaboration will benefit both doctors and patients.